Good afternoon, everyone, and welcome to the ADAM Alliance Quality Innovation Network Learning and Action event entitled Joy in Practice. My name is Melanie Dunning, and I am the Behavioral Health Quality Advisor in Indiana, and I will be your moderator today. As you may know, ADAM Alliance is a 5-year, 5-state initiative to ignite powerful and sustainable change in healthcare quality. We welcome participants from Alabama, Indiana, Kentucky, Mississippi, and Tennessee. Thank you for taking time to join us. We appreciate all you do to improve quality and achieve better outcomes in health and healthcare and at lower costs for the patients and communities we serve. We know it's easy to get into multitasking during webinars, but we ask for your dedication, energy, and engagement in today's workshop. Before we begin, I want to run through a few housekeeping items. Today's lines will be muted during the presentation to protect the sound quality, but we want to hear from you during the discussion through the questions feature located in your GoToWebinar control panel. We hope you will join the conversation. You can also find the slides from today's presentation in the Handouts section of the GoToWebinar control panel. During today's presentation, you will also be asked to participate in some polling questions. The polling questions and results will pop up on your screen. Be sure to click the Submit button after you have selected your answer choice. And now, I would like to welcome and introduce you to our speakers today from Cherokee Health Systems, Dr. Phoebe Wallace and Dr. Sarah Probst. Thank you for being with us today and for sharing your passion and knowledge about resilient clinicians and finding joy in practice.
Good afternoon. This is Sarah Probst. Thank you so much for having us kind of chat with you guys this afternoon. And what we wanted to talk with you about today is finding joy in practice and ways that we can build resilience both at the practitioner level but also kind of at the practice level. And so I'll start by talking a little bit about how, as individual practitioners, we can work to find joy in practice and maintain that joy in practice. And then I'll hand it over to Dr. Wallace, who will talk with us about kind of strategies to use at the administrative and practice level to help support practitioners in that quest to find joy. So everybody knows that healthcare and working in healthcare is a walk in a park, right? We know that inherently to kind of healthcare services working in healthcare, there are hazards that we experience every day. And these are just kind of inherent to the work that we do. We see folks who are in distress. We see folks who present with problems that they want immediate solutions to, that oftentimes there's not an immediate solution and there may not be one at all. And so a lot of times we're the recipients of kind of negativity related to that. The amount of demands that we face on a day-to-day basis, not just from patients, but also from kind of governing bodies and kind of professional bodies, is a major impact on our workday as well, that can become a hazard that we want to be mindful of. And then also just thinking about kind of the characteristics of the role that we have leading to burnout. We have a lot of responsibility for other people, other things. We may not have a lot of control over those areas. And so all of these things together factor in and create an environment that can be hazardous if we're not kind of careful. Knowing that the environment that we're working in kind of has these inherent boundaries, we also want to be aware of factors that increase our vulnerability to those things. And so when you're thinking about different providers kind of in the profession, I'm sure you can look at some and think, oh, wow, kind of they're managing things pretty well, things are going well for them. And then there's others that you can tell are kind of falling victims to some of these hazards. And some of the factors that can increase our vulnerability is kind of neglecting our own self-care, and just the stigma that often comes along with acknowledging, hey, we're struggling right now, we need some backup. Oftentimes we're hesitant to even acknowledge that or ask for that help. we're people too, not just providers. And so oftentimes the interaction between personal stressors and work stressors can feel overwhelming. And when those two things are kind of stressful at the same time, that can create a lot of tension in our work life as well. Again, like I said, we want to pay attention to this lack of leisure activity, poor boundaries, and then unrealistic self-expectations, and kind of the demands that we place on ourselves. Those are all things that we want to be mindful of as we're thinking about kind of the day-to-day work that we're doing. And so knowing that those things kind of pose a risk for us and kind of could be stealing some of the joy that we find in our day-to-day work, I want to talk a little bit about balancing caring for others and caring for ourselves. And it's always ironic to me that healthcare providers are really great at helping others care for themselves, but we're often the worst at listening to our own advice, practicing kind of our own words of wisdom, and taking care of ourselves. So I want to talk a little bit about kind of ways that we can do that and things to be mindful of along the way to kind of help build that self-care back into your day. The work that we do is inherently meaningful. And so it's important to remember that every day that you're going to work, kind of the impact that you're having on folks that day is meaningful, but these hazards can diminish that feeling of meaningfulness if we're not feeling effective. So one thing that you can do in those moments is focus on those things that you truly do have control over. So kind of professional expertise, quality of involvement and interactions with our patients and supervisees if you're in a supervisory role, and less on those things that we don't have control over. So ultimately, we can't control if a patient is going to be appreciative or kind of angry with us. So trying to focus less on that and focusing more on those things that we do have control over each day. And really taking time to savor moments of recognition and small victories. I think so often we get bogged down in the things that didn't turn out as planned or the things that we're trying to find solutions to, that we often miss those small areas of victory throughout the day, or that one patient that kind of patted you on the back and said, "Thanks, I'm so glad I came in today." It's easy to lose sight of those if we're not mindful and purposefully paying attention to those moments. I also want to encourage folks to adapt a long-range perspective. And so when we think about careers, we're hoping that they're kind of long-term 30, 40-year careers. And if we can start to think about kind of a personal self-care plan that helps us run the marathon, I think that can be really helpful. And so thinking about kind of our career and self-care as a marathon and not a sprint. And so what can you do on a day-to-day basis, on a weekly basis, on a monthly basis that helps sustain you in your work? And reevaluating that often. So if you've made a decision that you're going to attempt one self-care strategy, like going for a walk at lunch during the week, but ultimately that ends up causing you more stress than it is helpful, kind of process that, reevaluate that, and think, okay, that may not be the best self-care strategy, even though on paper it was a good one, and just think about kind of what that can look like over time and how that changes over time. Because we know that kind of in our early career, when we don't have family or outside responsibilities, it's easier to focus more on work. But as we move kind of forward in our life stage and in our career stage, there's going to be competing priorities. So self-care is going to look different at each of those stages. So when we're thinking about safe self-care, using the kind of marathon versus sprint analogy again, I know nobody on this call would think about running a marathon without stopping at the water stop. By the time you got to the end, if you made it to the end, you would be miserable. So I really want you to think about kind of implementing these self-care strategies as water stops along the way, and kind of taking strategic breaks and kind of using these things strategically to sustain you until you can get to the finish line. So things like making sure you're getting enough rest. And we all have periods in our life where we're just not sleeping as much as we need to, but trying to make that a priority, and when that's a possibility, kind of making that an action step for yourself. And nutrition and exercise, making sure that you're kind of eating routinely throughout the day, kind of drinking kind of water and keeping yourself hydrated, and maintaining relationships with people who are going to be nurturing to you, and also folks who are going to say, hey, you need to take care of yourself as well. So when you're not doing a good job with that, having those trusted people that can kind of nudge you back in that direction of self-care can be helpful. Thinking about how to work moments of relaxation or solitude throughout the day, especially during a busy clinic day when 5 or 10 minutes where you kind of sneak into your office can be helpful. And then engaging in positive distraction. And again, kind of finding what those are for you and how to incorporate those each day and each week. The other thing I want you folks to be mindful of and thinking about is time management. And oftentimes I think we consider time management as a way to control our time. And so I want to challenge you all to think about it a little bit differently and not trying to control every second of your day, because oftentimes that creates more stress, but rather kind of focusing on your ability to use your time efficiently. And so thinking more about kind of delegating tasks when that's a possibility, prioritizing tasks, and kind of using methods that save time. So skimming articles versus kind of reading the details. Going back to what I mentioned earlier, when we're thinking about kind of our self-imposed demands and responsibilities, starting to think about how can I manage that differently and prioritize that differently. Are there things that aren't as necessary to completing the day successfully that I could kind of let slide versus what needs to be done kind of more imminently. This is another area that I want folks to be mindful of as well, because I think oftentimes we can fall into traps and not even realize that we're in them. And so really being mindful of the difference between professional venting and chronic complaining. And so venting frustrations with colleagues and kind of expressing concerns about organizational or kind of professional demands can definitely be beneficial. If we're not talking about these things, change isn't going to happen. So we want to kind of have an outlet for those things, but we want to be really cautious that we're not falling into or crossing the line into chronic negativity, because this can be dangerous both for ourselves, for our colleagues, and for our patients. When our outlook kind of going into an exam room is more negative, that feeds into our interaction with the patient and can impact their care. It can impact kind of how they view their effectiveness in their own health care. So we really want to be thinking about that. And so kind of one challenge that I have for folks today is when you notice that there are frustrations or there are things that need to be changed or tackled, instead of thinking about kind of simply what is the problem, start to generate a few solutions, or at least a few ideas that move you in a direction of a solution, because that can help take you out of that negative kind of headspace and moving more towards a positive kind of direction of change versus just kind of being stuck in what isn't working and focusing on that. And then really being mindful of kind of what's termed in the literature professional brownout. So if you're noticing episodes of forgetfulness, kind of you're struggling to focus on your work or with family, you're noticing fatigue when typically you wouldn't be tired, kind of these are all warning signs that you're not taking care of yourself as well as your patient. And so kind of when you're noticing these things, kind of take a step back and think about how can I care for myself more in this moment. And again, kind of if you have colleagues that you work with or folks that work with you on a regular basis that kind of know you well and can say, hey, I can just tell something's a little off this week, kind of what's going on, or just wanted you to be aware. That can be really helpful because a lot of times when we're in just the daily grind of our routine, we don't often recognize when kind of we're not performing like we typically do. So if you have some folks that are trusted that can say, I've recognized this, I've noticed this, just wanted to let you know, sometimes that can be incredibly helpful as well. And so I'll end my section with this, just a thought for you guys. And each day may not be balanced. We're all going to have days where things are really chaotic. And so just noticing that we may not be able to keep every day balanced, but if we work to keep the week balance and the month balance, that really snowballs into kind of a more joyful practice, a more rewarding practice, and just that ability to care for ourselves a little bit better.
Thank you, Sarah. We'll switch the slide presentation over to me, and I'll get started. I'm Phoebe Wallace. I am the Director of Primary Care Services for Cherokee. I've been in practice over 30 years, with Cherokee 12 years now, and in my role as Director of Primary Care Services for the past 4 years. And Sarah talked about the marathon, the individual part of joy and balance in work. And now I'm going to go to the team sport part of this because we do not practice in silos. We practice as teams. And how do we produce that environment that brings meaning and joy to work? I'll speak to it from a leadership standpoint. I think it's important for whether you're a leader or not to understand how we need to approach this in our teams to help, again, guide and make your voice heard as a member of the team. So, oops, I went the wrong way. There's been a lot of discussion for years about what's been called the triple aim of healthcare, where we want better outcomes for our patients, we want the improved patient experience while lowering costs the best we can. It's become increasingly evident that these three aims cannot be met without a fourth aim. So focus is switching in HRSA and CMS to the quadruple aim, where the improved clinician, and I'd like to expand that to staff, healthcare staff and team experience has to be improved. If we're burning out, if we're getting fried, we cannot accomplish the other three aims. Just can't happen. So how do we build the teams? How do we build healthcare systems that provide meaningful and supportive places to work? And I'm going to present next information from the Institute for Healthcare Improvements, IHI, and I encourage you to go to their website. A lot of this information is from a white paper that they put out in 2017, and I have found this immensely helpful and a good framework for me as a leader in a healthcare organization to work toward producing that center part of this circle, happy, healthy, productive people within my teams, and that's our goal. So look at this circle a little closer, and you'll see around our goal for healthy people in the workforce, there are 9 components, and we're going to reflect on those a little bit more. They're felt to be core elements and in producing joy in the workplace. And if you look at the outer circles, you see that the senior leadership is responsible for all these areas. Middle managers or core leaders have shared responsibility in some areas, and then individuals have shared responsibilities with the rest of the team in trying to develop these core elements within the workforce. Again, senior leaders, we're the one that sets the stage. If we don't create a culture that embodies trust and improvement, and you'll hear these terms, fairness and equitable systems, over and over and over in any of the literature you read. Fairness and equity pervades any other area, and if these do not exist within your culture, you just can't have a healthy workplace. We must take as leaders responsibility for all of these components. In more of the point of care managers and core leaders, they're the ones that really put a lot of the thoughts and ideas into practice. And, it is sort of a balance between the benefits and the burdens of improvement, but, they're key leaders in really what happens at the point of service. And individuals, as Dr. Probst talked about, they benefit the team by taking care of themselves. I think that we always should encourage the individual care, but also important is that the respect of other team members is there. We cannot have areas where there is disrespect for other people within the team, and look for opportunities. I try to really reframe things into opportunities. How can we be better? Let's identify barriers, but what are ways that we can productively improve together as a team? So going a little further into the different areas, I'm going to start with the ones that are primarily the responsibility of your leadership. And to me, of all the 9, this is number 1 by far. We have to have a workplace where people feel safe. Physical safety is extremely important, every day. And there's another shooting episode. I don't think it's at a workplace. I don't know that people know, but, it's a scary place to be in society right now for many people. What do we do to keep our staff and our patients safe? We recently, at one of my clinics, had a patient come in that was very high on cocaine, making threats, and we had to have mechanisms to address those threats. We have to have our workplace free from fear of physical violence as much as we can. Equally as important, and maybe more important, is having psychological safety. And that's where there are respectful interactions by everyone. If there are disrespectful behaviors, then we address them quickly and consistently within our systems. We have to have people that feel secure in questioning procedures, seeking feedback, proposing ideas in a place where they're not going to be humiliated. There's not going to be retribution. If we really hope to make progress, there just should be open doors to ideas. Failure should be viewed as learning opportunities. Just that's what we want. We want a just culture. If you make a mistake, we're going to problem solve with you to see what we can do, rather than having a punitive atmosphere in our clinics. To me, this again is number one. And one thing that I have to continuously tell people that I work with, that I am here for you. I'm accessible. I want to hear you. I am approachable. There's no door shut. A lot of times when your leaders are busy, people won't come to you. They say, I know you're busy. I didn't want to come to you with this. Nope, that's not what you want. We want people to know that they can come to me, that whatever issue, it's important. And you're in a safe place, and I am here to discuss that with you. Meaning and purpose. All of us have mission statements. We have goals for our organizations. That needs to be the driving factor in everything we do in our centers, and that we continue to bring things back to what we're here to accomplish. Do people find meaning in their work? Are people seeing that their work makes a difference? That we're all in the healthcare profession because we want to make a difference, and we have to continue to tap in to that in our organization. Choice and autonomy. I have been in healthcare systems where there weren't enough guidelines and rules, and people had no compass to follow. But equally as destructive is a healthcare system that is so rigid in their guidelines and rules that people can't make decisions on the fly when appropriate. We shouldn't have to ask permission for every little thing that goes on. What is the flexibility that we can allow? And people are happier when they can make some judgments and decisions within the guidelines that we need to adhere to as healthcare organizations. That's very important. It can be too rigid and too structured, and we need to guard against that. And this, again, is driven by leadership. What flexibilities and choices can we allow our staff to make in their daily responsibilities? What voice can we let them have on a day-to-day basis? Recognition and rewards. Everybody needs to feel valued. It doesn't take a big pizza party all the time. It just can be making sure that we as leaders recognize the accomplishments and contributions of our valued staff, from the front desk back to nursing to the housekeeping to everybody. Everyone is important, and we need to constantly look for ways that we can recognize and reward people within our organizations. Just a kind word makes your day some days, doesn't it? We can't forget this in taking care of our staff. Now, I'm moving more into the area where there's joint responsibility with some of our core leaders as well as the upper management. Participative management. Some of these build on each other. We have to have the space to engage our staff. When possible, we need to involve our staff into the beginning stages of initiatives or changes that are going to happen. Sometimes that's not possible, but it's really possible more than we often allow. Get input. Your staff is going to be more engaged if they at least have a voice and understand the reasons behind a particular initiative or change that has to take place. We may not like, there's rules and regulations that the government places on us that we have to do. How can we meet those challenges together? This may not be a challenge we can change, but how can we do it? And staff can work better and more effectively if we involve them as much as possible in the processes. We should continue to inform our staff of changes that may impact them, and most importantly, listen. Okay, listen to everybody. Get not only when things are going well, but when they're going bad. Get input at every stage that we can. Teamwork. We want to feel connected. One big source of burnout is if we feel like we're doing all the work and nobody's helping, nobody's connected, I'm feeling overwhelmed. We need to build the teams so that there is cohesion and that we have shared understanding and good relationships. Coaches do that. That's how you build successful sports teams. And that's what we need to be doing within our clinic teams as well, and in our healthcare organizations. And some of this builds on the other things we said. Do members of your team express appreciation for what other members of the team are doing? Again, that's how you build relationships and connectedness. And these are the things that all of us do, from the individual up to the higher management. Again, we look to improve each and every day as a team and as an individual. What have we learned from the day? What have we seen in the organization? What can we think about to make better? It's just a part of daily practice. Wellness and resilience, Dr. Probst talked about. One thing that we do at Cherokee to build resilience in our providers is we have Ballant groups. I'm not pushing Ballant. There are a lot of different kind of groups, but Ballant in particular looks to improve the therapeutic relations between the healing professions and their patients by allowing safe spaces for clinicians to explore the complex emotional landscape of the clinician-patient relationship. We have currently 4, getting ready to start a 5th Ballant group where the providers meet together once a month, and that's a safe place where they can talk about the feelings that have been evoked in their daily practice. And it has been an important avenue to promote resilience within our providers. Real-time measurement, we have to have some way to know how we're doing, and we'll talk a little bit more about that. But constant feedback in measurable ways is important. We need to see if our quality parameters are moving in the right direction so that we can feel good about what we're doing, or if they're not moving, reevaluate and see what we can do to change. So here's some steps to help us on our pathway. First one is, what matters to you? Okay, I mean, we ask our patients this every day. What matters to you? What's the most important thing to you? What do we need to address today? And really listen to that. Our CEO, Dr. Freeman, has a group that meets with him on a routine basis that has a representative from every clinic. And that's the question, what's going on? What matters to you? When we're at our best, what does that look like? What should that look like? And that sets the stage for more conversation. When you ask these questions, however, you have to make sure that change occurs or something happens from the feedback. If you just listen and people go back and nothing changes, then you haven't accomplished anything. So you ask the question, you listen, and then it leads into the next step where, when you're asking about what would be our best, you have your team members identify the impediments to success or joy in work. What are the barriers? And listen to that. And that almost naturally, if you're promoting this kind of teamwork and camaraderie, it leads to brainstorming about what we can do together as teams to resolve these impediments and take these rocks out of the shoes that hurt every day. Because we all are here to do good for our patients, to be productive. So what's in the way of that? And joy in work is a shared responsibility. You can't just hand it off to someone at a HR department and say, hey, this is your responsibility. You may have a wellness system, but it's not just somebody saying, yeah, get out and exercise. It's a shared responsibility of all the team members at all levels. And we need to make that commitment that we want to be the kind of workplace where you feel good, where you have meaning, and we accomplish important goals. I do feel, in looking at the components of joy in work, as I said, I think physical and psychological safety are number one. I think followed by meaning and purpose, choice and autonomy, with fairness and equity as, again, the overreaching concepts. You may have to look at your organization, see where your strengths and weaknesses are so that you know how to move ahead, which leads me to the last point. There is a lot of improvement science out there with validated approaches that you can use to look at your organization and get a barometer about where you are so that you can know where to start in leading your teams to having a joyful experience in work. So this is some examples. There are certainly a lot of measures out there. The IHI white paper has more, and there's certainly a lot of other sources. But just here's a few simple examples. The first two do center around patient safety primarily, but you get a lot of information about your organization and assessment of your patient safety culture. Both of these questionnaires and surveys identify where you are, where areas of improvement are, and highlight your strengths. And the AHRQ one actually has some ability to look at this over time. You can redo parts of it and really get a measure of that. The Hackman and Oldman job characteristics model to job satisfaction is a tool that looks to see where you are with people feeling that there's meaning and purpose in their work, focusing on job enrichment and improving the nature of the work that you do in your clinics. But as I said, there's lots of burnout surveys. I am very much a proponent of us understanding these barriers and the things that lead to burnout. I like to try to think more in positive terms that we want to be proactive. We do need to see where we are and where the weaknesses are, but we want a proactive and approach to how we lead. On a local level, IHI, I think, has several good options. The 3 daily questions, certainly you're not going to go around every day and ask these questions, but I think you can create the space where you let people know that these are the things that you want to accomplish. Is every individual treated with dignity and respect by the other members of the team? Do you have what you need to make the contribution that gives you meaning in your life? Do you get the recognition and validation that you need for what you accomplish? So again, leaders, this goes sort of back to what's our best, what would that look like? You can ask periodically in meetings, if everyone could answer yes to these questions, what would it look like? And again, that leads to the conversations that you need to have within your organization. Pulse surveys, IHI has a very interesting approach where they have core questions that they ask on every survey, whether monthly or quarterly. And those are things like, overall, IHI is an excellent place to work. Is yes or no? I believe that IHI is going in the right direction. Yes or no? My immediate supervisor cares about the work I do. I feel comfortable bringing up problems and tough issues. I feel that people at IHI respect and take into consideration all views expressed. So they survey that routinely within their organization, and then at different periods of time survey different areas that they may want to focus on. They're trying to keep, like it suggests, a pulse, know what the pulse rate in the organization is at all times. Some places use a daily visual measure where you do something where people let you know on a day-to-day basis how they're feeling. A whiteboard that has a smiley face and a frowny face, where as you go out and you clock out, you put a check mark under where you feel that day, recognizing that some days the clinic is going to have bad days. But if you see multiple bad days, then you know that you need to do something differently. Some places use something like a jar with marbles, and at the end of each day you go down and put a marble in a different colored marble for how you're feeling. And so the next day somebody looks at the jar and counts up the different colored marbles, and they get a sense about where the clinic is. But then you need to improve. So what's the science behind improvement? A lot of people use this kind of cycle to make changes. You form an improvement team, and you have to have aims that are specific and measurable. The teams need to establish measures, select what to test, and then do a cycle, a PDSA cycle: plan, do, study, and act. You may have to do several cycles to really develop a change and refine a change. And once you find a good change, then you spread that change to other areas of your organization. One thing that we did is we had a team that identified that they were having a very high rate of no-shows for new patient appointments, up to 30% no-show rate. So, and then that wasted time for the provider. And for those that did show up, a lot of times they didn't have all their medicines, they didn't have all their records, and it was very frustrating for the providers and all of the team members. So they developed the idea of an engagement clinic where you would schedule a new patient appointment with a provider and say, we're going to bring you in several days prior to the appointment and get all your information so that visit with the provider can be the most productive. We still had 30% no-show into the engagement clinic, but when the patients arrived at the engagement clinic, They were initially met by front desk personnel where they got all the demographic and insurance information that they needed. Next step was a nurse who obtained all of the histories, got the medicine list if they needed to call the pharmacies, did that. If records are needed, got those requested, but basically got the chart loaded with all of the historical information we need. We also had the patient meet with our behavioral health consultant who did depression screening, SBIRT, ACEs screening, identified needs in the social determinants of health, and if needed, went ahead and made the links to behavioral health services or other services that patient needed right then and there. If an acute issue was identified, then we did have spaces for the patient to be seen right then. But if it was not acute, then the patients were invited to come back to the appointment with the provider. We went from a 30% no-show rate to the provider to less than 10%, in some months 100% show rate. So, it was an important tool to engage patients. I think patients have found that to be more rewarding. They felt like they were being heard and not rushed, and that providers had everything they needed. And providers and nursing staff certainly have been much more pleased because everything is done and they can really do the work that they need to do. So, in teams, there are times where it feels like this. Everybody's pulling in different directions and nobody is getting anywhere. It can feel like that sometimes. We all want it smooth out on the leg, just rowing, having a good time, easygoing. But it's not like that. Our reality is this, where you're in a boat, you may fall out, team member pulls you back in, you're going through some smooth times and some rapids, but you're working together to achieve a goal. And this is what we want to promote. Look at all the smiling faces. This is where we want to head as teams in our healthcare system. So I hope that this was helpful information. And we're now open for questions.
Yes, we have some questions. The first is for both Doctors Probst and Wallace. So September is Suicide Awareness and Prevention Month, and there's data to suggest that suicide rates amongst physicians is almost twice the national average. What suggestions do you all have to mitigate the stigma around the helpers seeking help for themselves due to work-related stress and burnout?
Sarah, why don't you start? And are you still on mute? Okay.
No, I think I'm unmuted, yeah. So I think kind of a lot of what we've talked about today is creating a culture of safety in the office. And so I think not only is that safety for patients, but safety for providers. And so kind of thinking about as an organization or as a practice, kind of what is the best protocol for your practice? Is it kind of checking in frequently about kind of how we're doing in terms of status? Is it having an identified person that if somebody's recognizing that they have a specific need, kind of there's a point person that they could go to access resources while still kind of maintaining privacy and things like that. So I really think kind of in general, we want to be asking these questions and gauging how folks are doing, but then kind of having a procedure in place that works for that particular practice and that particular clinic for how to access those resources.
Yeah, I think that we have to be more aware of where our individual providers or any member of our staff are, and that's why it's so important to have consistent, continued communication, so that, and be observant to changes in behavior. I think a lot of times we are too slow to just say, hey, come into my office. I've noticed, that, you don't seem to be as happy, or you don't seem to be as efficient as you usually are. I just want to check in with you. And again, if you open that, you are safe and you are secure, and that we are here to support you, that gives a lot of ease to people. I had one provider recently who, unbeknownst to us, is going through a divorce, and we recognized that she just was not keeping up on her charting, not keeping up on her work. And, we had to, we just said, please, we're not purposely trying to delve into your life, but we're noticing that you're under stress. How can we help? And so, we help to link that provider into services to help her. So I think you got to keep your eyes open, and it is a concern. I have a concern as an administrator with all the duties and responsibilities that I have, missing that. But that's why you need the team. You need the team members watching out for each other. You need all levels of management looking out for each other, and the upper management needs to be looking out for each other, because again, there are lots of duties, lots of stress, and being aware if we notice changes to say, my door's open, please let me know. You're right. It's suicide, it's substance abuse. And if, again, what happens in individual life, and this gets back again to what we talked about in shared responsibilities, when we see that an individual may not be taking care of themselves like they used to, I think we need to explore that.
Great. Thank you for those responses. Dr. Wallace, this is a question for you. So in your 30 years of practicing medicine, what is your perspective on the increase around provider burnout? There's a lot of focus on provider burnout. There are decreasing numbers of students pursuing medical school to practice primary care specialties. Have things gotten worse, or are we just more aware of these challenges?
Oh, I think some of both, actually. When I look back 30 years ago, where we worked these ungodly hours as a resident, now there are limits in resident hours. There were no limits 30 years ago, let me tell you. But I do think that it is more difficult now, and it is because of there are lots of reasons, but certainly the amount of things that we're responsible for, particularly in primary care. We're not reimbursed nearly what we should be for the work we're doing. We're responsible for everything. Everything, in primary care. And I think in the reporting that we have to do to so many entities, and just, I think the electronic record, and everybody acknowledges this, that just the amount of time we're spending with our noses in the record trying to keep things up is stressful. What we're looking for is how we can better, what we can do in our workplace to reduce the burden on all levels of healthcare. If we ask nursing to do more, that puts more burden on them, and that trickles down. So we're constantly looking, trying to remake and get ideas about how we can be more efficient. Can we use scribes or to help with the documentation? What can we train people that in MA? How much can we train within our system in MA to do to help with the burdens? It's really the day-to-day documentation and fighting insurance companies and all of those things that are tiresome. But I'm still committed. Primary care is so meaningful. The difference you can make in the lives of others is just so immense. And I think we, as primary care clinicians, need to work within our organizations. I know that this was a huge topic of discussion at the National Association of Community Health Centers meeting last month. In fact, it probably took up a third of the clinical practice committee discussion. And we have to advocate for help in streamlining and making systems work more efficiently. And so I think that's what we, and I do work hard. But look in your organization. We've done some lean. If you know the lean process that was developed by Toyota to produce efficiency, we've done some lean projects that have made immense differences in finding the inefficiencies to make our lives better. But no, I think, I don't have all the answers, but I am committed to still to look for them and advocate within the government and insurance to make our lives better and make primary care a place that is meaningful for people again. It's brought such joy to me over 30 years, and I really hate that people don't see that joy. We have to continue to promote that.
Excellent. Thank you for that response. We've got time for about one more question, and this is for both Drs. Probst and Wallace. If a clinician or frontline clinical staff from a practice were to ask you today for one practical suggestion on how to attend to the stressors of daily work life, what one thing would you impart to that question, to that person?
That's a great question. I think what I would say, kind of being in a smaller clinic, kind of within our larger organization, is take care of each other. And so I think we all know, like, if one person in the building is having a bad day, that gets contagious really quickly. And so I think if we can take care of each other and we notice somebody's having a stressful day, what can we do to support that person? Because often that makes the day go more smoothly for everyone. And so that would be the one thing I would say to be aware of and be mindful of, is how can you help the person that's struggling that day? Dr. Wallace, what would you say?
Yeah, I think from the organizational standpoint, I think when I identify a problem or I hear a concern, is acting quickly. I think, it's still unfortunate that issues are brought to my attention often when they've boiled up. So I think response, meaningful and is rapid response to address the problem. If you can't address it right then, keep that communication. I will say, I'll have time next week, and then I make sure I continue to touch base with that person until I accomplish or address the need. I think we support each other. And I think from a leadership standpoint, leaders get burned out by taking too much on. I think we all have to identify, okay, I have reached my limit of what I can do. And again, bring your team members in, delegate. It is just so essential that you don't feel like you have to solve all the problems yourself. You don't. We are a team, so use your team.
Excellent. Thank you both for those responses. We are out of time for questions. Melanie, the floor is yours.
Okay. Well, I want to give a big thank you to our speakers today for a meaningful discussion, and our audience for joining us today and for all the great work you do every day in serving others. Please complete the evaluation that will come up as you exit the webinar so we know how we did. We value your feedback in developing future events. And finally, please join us through your favorite social media venue. We look forward to connecting with you.